Thanks for staying with us for this special edition of Conversations. We're talking about prescription drug abuse, and my next guest is Dr. Richard Gracer, founder and director of Gracer Medical Group in San Ramon. Dr. Gracer runs Gracer Behavioral Health Services, which is an innovative and comprehensive substance abuse program. He is the host of the radio program A New Prescription for Health, heard on womensradio.com, as well as editor for a newsletter of the same name. He's also author of the book A New Prescription for Addiction. Dr. Gracer is joined by one of his patients, Tiffany Thomas, who has graciously agreed to share her story with us today in the hopes of preventing others from falling into the same trap as she did. Welcome to both of you. Let's begin with Dr. Gracer. How big a problem locally is this? We're really trying to say this isn't just happening in other people's neighborhoods. It's happening right here. What do you see?
Well, it's happening all over. I mean, this is something which is just taking the whole country. And in our area, which is a fairly affluent area, it's especially bad. We estimate that approximately 20% of kids in high school have abused prescription drugs sometime. Not that they're all actively addicted, of course. We also know that about 30% of everybody has got the genes to get addicted. Those are the same 30% who get hooked on cigarettes. You know, all the kids try it, and the kids who've got the genes can't get off it. That's where the smokers come from.
Can it happen after one try? Can you know, be that one person?
You're talking about the prescription drugs?
Yeah, I mean, if you're one of those people that would get addicted immediately, can it happen quickly?
It's not likely. Well, one try versus quickly. One try, it's not likely to happen. I mean, you can, the first time someone smokes a cigarette, they cough, right? I mean, it's hard to do it. However, and we can talk more about this, when you get into the stronger drugs like OxyContin, and we can talk about the details of that, it's pretty interesting actually, it can happen amazingly quick. We have patients every week that have had an addiction problem to something like Vicodin or Norco, which is a common painkiller. Those are the most commonly abused drugs. Then a friend gives them an OxyContin, which is up to 80 milligrams. And they're off and running. Within 2 weeks or a month, they're totally addicted. And we have a whole series of people like this that did, you know, they weren't doing okay, obviously they're abusing drugs, but they really, really self-destructed when they started on these high doses. So it can happen quickly.
What happens, okay, so if you're Vicodin, for example, used for pain, and when you've got pain, and Tiffany will tell us her story of this, you take the Vicodin. What happens physiologically to the body when you take something like Vicodin and you don't have pain? Is there a euphoria? Why are people doing this?
The people who don't have that genetic set, or they're not into that, it's hard to understand because most people take Vicodin, it helps the pain and makes them a little tired and they don't like it or nauseated and they get off it as soon as they can. But the other people, it gives them euphoria. And there's a whole set of people that have emotional problems, like anxiety is one of the primary reasons, also depression, that people take these things. Because there's a whole group of people that are not happy to begin with. They're having a lot of emotional problems. These are the same young people that might have even in the extreme bipolar disorder or bipolar chemistry or just anxiety, depression. And they take these medicines and they really feel great. I mean, it solves the problem basically, of course, very short term. Sometimes somebody will have a broken leg, for example. Legitimate, go to their doctor legitimately, and this byproduct of having this euphoria and actually feeling normal, some of them will say, comes on and they don't want to get off. But then of course it takes a little bit more and a little bit more and a little bit more. And then when you try to get off, you're very sick. So the self-medication thing happens. Of course, the people with that genetics get high and they enjoy the high. That's called the positive reinforcement of taking drugs. You like the way you feel. Have a drink after dinner. Then it flips over, unfortunately, into what we call negative reinforcement. This happens very quickly for these people. That means if I don't take it, I feel awful. And all the things with drug addiction that you have heard about and all the things about withdrawal, the nausea, vomiting, many, many problems come on, and people aren't not going to feel like that very long. So, of course, where's the next time they need to take the drug? They have to buy it, whatever they have to do.
Tiffany, tell us your story. And I have to first tell you, I'm so glad you're here because we've been talking about death after this, and you have survived this, but that's no picnic either, is it? Tell us what happened. You were 19, you were working, and what happened?
Yeah, I was injured on the job and went to see a doctor. The doctor just wrote down 3 different types of painkillers and asked me to pick one. and I had never even heard of any of them, so I asked her which one would be best suited for me, and she prescribed me Vicodin. She gave me 75 of them a month for an entire year, and that initial visit was the only time I ever saw her. I just called it in and she refilled it. It was not long after that I got addicted. Addiction runs in my family. I had started drinking when I was 13, smoking weed at 14, so I was unaware of the fact that it was an addictive substance, but I got hooked very, very fast. And I went off and on of them for about 3 years or so, mostly on them. And you know, it does gradually where you have to keep taking more and more
to get the
effect.
Yeah.
And so then you start doing the doctor shopping and finding doctors that will prescribe it for you and buying it off the streets. And I did go up to using Norcos, which is basically like taking 2 Vicodin. Right before I started doing the Oxycontin, I was at about around 40 Norcos a day. It's about 80 Vicodin a day.
And are you able to cope? And I mean, what happens to you? What are you feeling as you're doing this? Obviously needing more and more to just feel okay.
Yeah, you're kind of like chasing a high. It never gives you that euphoric feeling that you experienced in the beginning. It's more of just, if you're not taking it, you're having all the withdrawals. And it's almost like you don't have a choice anymore. You have to take it, or you're going to feel awful.
What are the withdrawals? I mean, what happens to the person who's now addicted? And let me ask both of you that question. What it would feel like to you such that you had to go back and take another?
You know, you have a lot of anxiety. You feel like you're going to throw up. You get very sweaty, and you don't sleep at all. It's just very uncomfortable. It just brings you completely down.
And so, doctor, how can people, possibly fight back to that? I mean, that's where obviously you come in. Can they even help themselves at that point, or is it professionally only?
Well, there's a couple of things about it. I'll make a few comments. First of all, 40 a day, wow, right? I've seen it 60 a day. And that's also 40 or 60 Tylenol a day. Now, you know all the stuff about taking acetaminophen as far as liver failure. So how can these people take this? I sometimes ask myself, especially if they're drinking, they can end up with needing a liver transplant. I mean, that's pretty amazing, the risk that you take.
Yeah.
It's true.
And I was very fortunate because I was always drinking when I was taking them, always drinking.
So young person with a good liver, then you gradually built up to it.
Yeah, get the tolerance.
Now, so what the most people do is, of course, they go back to using. The thing about opiate withdrawal is that it's incredibly uncomfortable. I mean, you also get diarrhea and cramps and all kinds of horrible things, and you feel like you're going to die, right?
Yeah, you really do.
But you don't. And that's the thing about it, is that unless you have a heart disease or something, if you're a young person, it isn't fatal. It just is absolutely awful. And it can go on for days and days. And then the other problem is that it leaves you with what we call post-acute withdrawal syndrome, which is that the receptors, okay, you're not having vomiting or whatever, but you feel pretty bad. Did you ever go a length of time trying to get off on your own?
Yeah, I did. I think I got up to 7 days was as long as I could go.
And how did you feel at the end of 7 days?
It sounds like it doesn't get better.
It really doesn't. I mean, it's a lot of depression and just feeling like your life's over, like there's nothing good left.
This can go on for weeks and months, and eventually people use. That's why the success rate for most programs is about 15 to 20% at a year. The 75 or 80%, say, of people with this problem go back to using because they feel so terrible, and that's because it does brain damage to you. Plus you have the genetic underpinning I was talking about, and there's some long-term brain dysfunction, and it's a brain disease. So you asked me, what can you do yourself? Well, you can take plenty of fluids, and you're not going to die, most likely, and people have gone through this, and some people are okay. but seeking professional help is a very good thing. And there's medications we use, of course, to make it easier. But the real problem isn't the first week, or even the first 2 weeks, or if you're in rehab the first month, because now you're basically in rehabilitation, and you're not going to be able to use drugs and eating good food and whatever. It's what about the rest of your life? And that's with this ongoing malaise that goes on for a very long time, sometimes years. I mean, sometimes it doesn't go away. You inevitably are going to fall back. So what we need to do and what we're doing now is we're treating the brain disease, and we're treating it with a variety of different medicines depending on what the addiction is. So prescription drug addiction, there's a drug called buprenorphine, which is itself addicting, but it has some properties that make the brain, help the brain work almost immediately, and then we can get to work on all the behavioral and psychosocial things. They obviously have to do everything for these people. They need intensive treatment. It's not just a pill.
Well, Tiffany, what is your life like now? I mean, day to day, is it just a constant on your mind all the time?
Yeah, it's always in the front of your mind. You know, I'm seeing a therapist on a weekly basis to get through all of the underneath stuff. You know, like I'm not on the drug anymore, but I do suffer from depression and anxiety, and so I'm working on all that. I'm going to a lot of meetings. The meetings at Dr. Gracer are extremely helpful, and a lot of the newcomers that have started the program, I'm also helping them find meetings and kind of like just giving them help, because it's helpful to have someone in the very beginning. But it's always constantly with you. Like you need to have it with you to remember, this is where I was, and this is where I am, and you know, then that's why you have a sponsor, and this is where I want to be. So yeah, it's always with you.
Will it be hard for Tiffany for the rest of her life, or can she look forward to a time when she can say that is truly behind me?
Well, this is very interesting because let's say there are two aspects. Of course, there's more than two. One is the physiology of the brain, you know, and over time, I think her brain will be fine. And it depends. It takes time to know. We get her off and wean her off the medication. But once you went on the buprenorphine, Suboxone, Subutex medicine, how did you feel physically? That
was like the miracle pill to me. Because I was on Oxycontin for a year, after the Vicodin and Norcos, I switched over to Oxycontin, and getting off that was just. I called Dr. Gracer's office on a Friday, and they couldn't get me in until Monday because I called at the end of the day. And so I went to the ER to try to get something to help me, and nothing helped. It was just a horrible, horrible, horrible 2 days. And once I came in Monday morning, and they put me on the Subutex, and I just felt a million times better. And it's helped me to stay off of it.
Well, we have to run to our next segment, but real quick, was her doctor what they call a dirty doctor?
A careless doctor.
A careless
I mean,
doctor.
I don't know.
Yeah, I mean, just...
There are dirty doctors. I guess you talked about that
Yeah,
too.
a little bit, and we'll talk about it a little bit more.
And it takes a year. I want to answer your question quickly.
Okay.
Our program's at least a year that she'll be working with therapists.
Good for you. Good for you, Tiffany. Well, I thank you both for coming in. We'll return with our final segment of this special conversation on prescription drug abuse as Bob Pack joins us to share how his family's tragedy brought him to Sacramento to author a bill to help prevent others from experiencing his nightmare of 7 years ago. You're watching a special edition of Conversations. We'll be right back.